Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Don't forget to subscribe to my channel and also please give your valuable comments. You can also visit my playlist. In the playlist, I have provided all the topics so far discussed in a very systematic order. You can also make use of it. Anyway, my dear friends, today onwards we will start a new topic which is a very important topic in comorbidity or pediatrics. So that is about short stature. Short stature is one of the very important topic because in the day-to-day practice, in the OPD practice, so we come across with many patients of short stature. And early diagnosis of the short stature may be helpful to diagnose so many incoming disorders or upcoming disorders, and we can adopt the proper treatment and the patient may be get benefited. So with this regard, we will have a detailed explanation of a short stature for next few classes. In the beginning, what is the definition of short stature? So when you say that this particular boy is having short stature, girl is having short stature. Short stature is diagnosed when the height for age and the sex is below third percentile compared to rest of the population. That means in the height chart, height for the age, what should be the height, and for the sex, what should be the height. Height for age and as well as sex, if it is below third percentile, not percent, percentile, compared to the rest of the population, so then that condition is usually statistically, it is called as short stature. Height for the age and sex, if it is less than 2 SD, this is a statistical definition. Okay, height for the age and sex less than 2 SD, below the mean, is also called as short stature. So we shall see this one by one, what it is. So what are the three main approaches that we have to follow when we get a case of short stature? Okay. So first thing is you first measure the height of the patient or height of the child for age and as well as sex. Then you estimate the mid-parental height and fix the target height. Lastly, calculate the height velocity. So these are the three approaches that we have to see. Once you diagnose that this case is a short stature, the work is not over because there are so many types of short stature. Familial short statures are there, constitutional short statures are there, okay, disproportionate short statures are there, proportionate short statures are there, short statures due to so many chronic diseases are there, short stature due to some of the endocrinal problems are there, so short stature because of chromosomal problems are there. So it's a big pool actually. Short stature means we are just making a very superficial diagnosis. Once this short stature is made, that means diagnosed, then comes the next task of identify what is the cause. So therefore these three approaches are very important. First, you say yes, it is a case of short stature because it is less than third percentile. Now measure the height for the age and sex, then estimate the mid-parental height and fix the target height. So this is especially very important to differentiate the familial short statures, and then you calculate the height velocity. In one particular year, what is a height velocity? What is very important for all these things is growth chart. Maintenance of the growth chart is very important. Now we shall see how to see the height for the age. Okay, height for the age. Suppose if a child is 3.5-year-old and in the x-axis, suppose if you plot the years in the growth chart, height chart, it is given in the x-axis there will be years and in the y-axis there will be length in centimeters. Okay, now suppose plot this in the chart and see does it above the third percentile or not. If you look over here, this is actually the growth chart. Okay, so blue is always for boys. Okay, so if the color is blue, it is for the boys, and pink is always for the female child. Now this is for the male child. So this is x-axis and this is y-axis as mentioned here. In the y-axis we are mentioning the length, and in the x-axis we are mentioning the years. You can see 1 year, 2 year, 3 year, 4 year, like that. Okay, these are years. Okay, age of the child, and this is length of the child. So when you plot like this, okay, so now suppose if the child, in this case, suppose the child is 3.5 year old, and in the x-axis there will be years in 1 year, 2 year, etc., and in the y-axis there will be length in centimeters. Now plot this in the chart and then see, does it above the percentile or third percentile or not. Suppose if this is a case, you suppose a child is 2.5 years here, okay? A 2.5 year old child, isn't it? Yes, no, 3.5 year old child. So it is somewhere here, 3.5 year old child. From here onwards, you see the length of the child. What is the length of the child? Length of the child given? It is not given. Okay, anyway, suppose the length of the child, if you say length of the child is 75 centimeter. Okay, presently 3.5 year old child, 75 centimeter is the length, height. Okay, so then you just plot this 75 over here, which is there in the y-axis, and see according to the age you try to plot here. 3.5 years, it is coming somewhere over here. Okay, if it is 75 means coming over here. So now if you see, it is less than third percentile. See this line, this line indicates third percentile. This is, it is given, I'm very sorry, it's not so clear here. I will show another picture. Okay, so here it is third percentile, this is fifth percentile, this is 10th percentile, like this, these lines are there. Now in this baby, it is coming below third percentile. As it is coming below third percentile, this is a case of a short stature. This is a case of short stature. Okay, so suppose if you are plotting for the 2 years old child with 65 centimeter, just go for this 2 year old child and 65 centimeter. See, 60, this is 75, this is 70, this is 65. So age of the child is 2 years, so it's coming over here, 65. So if you see, it is below third percentile. This is a line of third percentile. Okay, this whole line is a line of third percentile. So below third percentile, again this child is also having short stature. This child is also having short stature. Okay, so then suppose if you are plotting the 2 year old child with the 65 centimeter, then it will be way below, very below, isn't it? Too much below from the third percentile line, and the child has got definite short stature and need to be evaluated. This may be mostly some endocrinal problem like growth hormone problems, what you say, dwarfism. Okay, because it is not only less than third percentile, it is coming in minus. Okay, okay, it is 0 and then minus, less than -1 also. Therefore definitely it is a clear-cut case of short stature, that also very severe short stature, probably dwarfism. Okay, that discussion we will do in the next classes. Now then another child is 2 year old and it has got 75 centimeter. When you plot it, it is around 15th percentile, which is fairly okay for this age. Suppose you take another example. Suppose you take another example. What they are telling is 2 year old child. Child is 2 year, okay. So we are getting here in the x-axis 2 year, and the 75 centimeter length is 75 centimeter. See 2 year, this line, I will go over here. 75 centimeter is coming over here. Then I combine these two like this. It's coming over 2 year child, 75. It is almost all coming over here. Okay, this is 75, no? Yes. So it is coming over here. So now it is somewhere coming over here. Okay, so now this is just above the line of a, this is just above the line of a third percentile. So that's, they are telling, just another child is 2 year old child and it has got 75 centimeter. When you plot it, it is around 15th percentile, which is fairly okay for the age. Okay, it is, this child is not falling in the short stature. The child is 2 years. See, actually when you calculate the height, in the first year child has to gain 25 centimeters. So at the time of the birth, the length of the child is 50 centimeter. First year it has to gain 25 centimeter. So it's about 75 centimeter. In the second year, again child has to gain total 12 centimeters. Okay, So now here this 2-year-old child has got 75 centimeter, fairly just touching the third percentile line. Okay, so 50-50 chances are there that it may lead to short stature in future if any problem is existing, or it may pick up. Both possibilities are there, but it is now under the risk of short stature. Okay, now how to see the height for the age? So this is what we have seen, height for the age we are seeing now. Actually, any child who falls on above criteria need to be evaluated. What is that criteria? If the height for the age and sex is less than third percentile, okay, again, lower the percentile, high will be the suspicion. It is too much low, then high will be the suspicion. In the point itself, okay, in the border line itself, okay, 50-50 chances are there, anything can happen. Okay, this is one thing. For example, if the percentile is less than 1, need more evaluation from the child with the third percentile, and chance of pathological short stature is important. Okay, so if the child is just below the third percentile, the child may or may not be pathologic. See, less than percentile less than 3, we will call it as short stature. Suppose if the child is having percentile less than 1, too low, okay, so then this child has to be evaluated very seriously. Okay, they compare to the third percentile child, third percentile child. Okay, because a child having pathological short stature because of some of the disorders, maybe renal disorders, GIT disorders, something like that. Okay, so that is also having the chance of developing the less than 1 percentile which is less than 1. Okay, if from the beginning itself the child has got pathological problem, congenital hemolytic problems, okay, or chromosomal problems, or maybe some renal problems, so child height is too much low, okay, it is almost all at 1 percentile, then this has to be very seriously considered and it has to be evaluated. Okay, so this is how we have to see height for the age. And if the child is above third percentile, suppose, so we have seen too low at the junction, now above third percentile, but it is more than 10 centimeter below the target height, then you still consider it as a pathological. Now, if the child is above third percentile, but it is more than 10 centimeter below the target height, suppose if I say a 10-year-old boy, okay, a 10-year-old boy has to gain, for example, I am just telling, a 10-year-old boy has to get gain somewhere around 140 centimeter, okay, centimeter of height. Now, if that boy is 130 centimeter, example I am telling, it is not exact, 130 centimeter or 125 centimeter, that means it is 15 centimeter less than the target height. Okay, but it is more than third percentile. It is more than third percentile. Okay, so in the chart, if you see, it is more than third percentile, but from the target height, it is 15 centimeter less. And this should be also considered very seriously because this may be a cause of pathological short stature. Okay, so just above the third percentile, you cannot relax. It is not considered as short stature, I will agree. But once it is not considered as short stature, it does not mean that child is safe, because child is too below the 15 centimeter below the target height. कितना उसको अचीव करना था, उससे 15 सेंटीमीटर नीचे है, तो इसलिए वो सही तो नहीं है. हाँ, शॉर्ट स्टेचर वाला एक टैग उसके ऊपर नहीं लगी. ओके, बिकॉज दिस चाइल्ड इज नॉट ग्रोइंग अकॉर्डिंग टू द जेनेटिक पोटेंशियल. सो 15 सेंटीमीटर वो नीचे है, इसका मतलब है कि इट इज नॉट ग्रोइंग अकॉर्डिंग टू द जेनेटिक पोटेंशियल. So rest of the things we will continue in the next class. Thank you very much. Again, don't forget to subscribe to my channel and also please give your valuable comments. Thank you.